Dearly beloved, we are gathered here today to get through this thing called life. Electric word, life, it means forever, and that's a mighty long time. But I'm here to tell you, there's something else. The afterworld. A world of never-ending happiness. You can always see the sun, day or night. So when you call up that shrink in Beverly Hills, you know the one, Doctor, everything will be alright. Instead of asking how much of your time is left, ask him how much of your mind, baby. Cause in this life, things are much harder than in the afterworld. This life, you're on your own.
So I guess one of the things that we've seen already this morning is other industries talking about smart, talking about IoT, talking about what's going to happen next. What is interesting in the last presentation, all those lists of different verticals that smart, that IoT is involved in, healthcare wasn't mentioned once. And yet, it's probably the area we should be trying to make the biggest difference in. Smart devices, IoT in health could truly make a difference. But it hasn't come to health yet, and particularly in Ireland, a country that, it's a matter of public record, has not invested well to this point in digital in healthcare. We've heard about how quickly the world is changing, but it hasn't come to healthcare yet. And there's so many reasons for that. But as we go through the next 15, 20 minutes, I'm going to try and persuade you that actually healthcare invented IoT, healthcare invented business intelligence. And yet, it hasn't become mainstream in there. And I wonder if one of the reasons for that is how healthcare is structured. So this picture is Singapore Business District in 1969. In 1969, the people of Singapore said, regardless of political change, regardless of financial situation, we will have a business district. Maybe this is one of the reasons why healthcare hasn't been able to change. Because healthcare is a political system, no matter where we are in the world. And to deliver innovation, to deliver IoT into healthcare will take a change similar to the Singapore Business District. That's what we have today. So I propose a question. The world has been changing so fast. Things like IoT, innovation generally across digital is making a difference. But when can it come to healthcare? If we're to try and change healthcare, we need to keep an eye on everything that's happening. The bridge behind me is a bridge in South America. It's a bridge a Japanese firm built. It took them from 1989, 6 years to build. The problem is by the time they built it, the river had moved. Now the bridge still features in the catalogue of the architecture firm that built the bridge because they're very proud of the fact it's still standing. But there's a real risk that healthcare and technology could fall into a similar situation. I've got my monitor on, so that's me allegedly walking up and down this stage at the bottom. But one of the things that I do think is a huge impact on healthcare is wearables, is that Internet of Things element to where we can go. But what we can't do is stop, stand still, and wait for 10 years until we catch up. We have to look every year at the different things that technology can do in healthcare. We have to look at how digital can change healthcare and how the things that you're going to hear about over the next few days make a big difference. Ireland has a plan, and we'll get to how some of those details impact on what this conference is about. But the plan will take Ireland away on a journey between now and 2020, from very much a paper-based healthcare system to one that is a digital healthcare system. Ireland is the last modern world country to not have an electronic health record. That's a scary prospect for all of us. The two cities on the picture behind me, Barcelona and Dublin, my two favourite cities in the world. And I'm not just saying that because I now live here. Very, very different cultures, very, very different ways of living. Barcelona, you come to a corner of many, many streets and there'll be a nice little place to stop and have a lovely glass of red wine or vermouth. In Dublin, my friends who come over from England will suggest that every road, unfortunately, I think, leads to Temple Bar. It's not strictly the case, but you start to understand the differences in culture by looking at two big pictures like that. What we can't do with healthcare is simply overlay a healthcare model, a technical model, as an IoT solution from another country into healthcare. It has to fit the way healthcare is delivered. And Ireland has a very different healthcare system. It isn't like the US. It definitely isn't like the NHS. It's unique. It's special. And I bet in every country my equivalent would say something very similar. So how do we make IoT work in that space? If we have an electronic health record in 2020 in Ireland, the ability to have data across lots of information sectors, the ability to start to create a single digital fabric for the healthcare system. If that is in place, why should IoT not be part of that? Why should we not have connectivity across what we do? There's this concept of a hospital without walls, a healthcare system without organizational structures. IoT is an enabler for that. How can we start to take away the walls of a hospital? This picture is actually a hospital in Buffalo, in the US. Patient arrives into the room in that hospital, and whatever room that is, the patient stays in that room. The room reconfigures around the patient. Truly a hospital without walls. Devices connecting the patient to the systems, delivering a different way of having care. A real enabler to how we change the care delivery system and make it safer and more efficient. See, one of the most amazing things for Ireland happens in 2 weeks' time. Our first electronic health record goes live. Cork University Maternity Hospital, said to be one of the busiest maternity hospitals in the EU, very new, lovely, shiny building. Currently, the hospital runs on paper. Currently, a baby born in Cork has simply an appendix to her mother's or his mother's paper record. 2nd and 3rd of December sees that hospital have its first electronic health record. It also sees us now connecting devices to the baby in care to the electronic health record. Early warning systems, early warning information to clinicians, decision support from devices connected to the child that has been born. You guys are involved in this business. You know that's not rocket science. You know that's not that hard. And yet, it's taken us a long time to get there. We've started terming not IoT, but IoTP, the Internet of Things and the patient. How do we put the patient at the center of IoT? How do we allow the patient to choose how they are involved in their care? How do we allow a mother and father to choose? The solution deployed in Cork allows the mother and father to be able to see the vital signs of their baby who may be in ICU on their phone via an app. How cool would that be and reassuring for the father who's at home, for the mother who's on a ward, to be able to see those vital signs on an app from solutions that you guys all know about. But here we go. This is a proposal we tried to put together. Did healthcare invent IoT? Maybe not quite, but we took this sort of long journey of saying most mothers, for the last 30 years, families have had a baby monitor. Now, yeah, it's radio as opposed to Internet of Things. But maybe the first real commercialization of being able to monitor somebody and really, truly have access to information comes from healthcare. We've tried to say the same with business intelligence, with Dr. John Snow in the UK inventing BI through the use of sort of research into cholera. But there is an element here of health trying to take back some of those inventions that have come there. Health trying to put back in place how these different things can be done. One of the things that I am worried about, though, constantly worried about, is IT is good at designing stuff without always checking what people want, whether that's clinicians or whether that's patients. And I think one of the things that Ireland is trying to do different to the NHS, to the US, to other countries that have done digital health, is make sure that we have that user experience at the center of what we do. So when we talk about IoT implementations into healthcare, we have patient groups to help us understand what they should be. When we talk about wearable devices and tracking information and building what we do, we have patient groups who help us understand how to do that. This weekend gone, there was a hackathon for solutions for bipolar disorder. Patients, clinicians, and technology people in a room to work out where is the level of intrusiveness from the collection of information from devices? How can a patient accept or not that information being shared? The culture of IoT in healthcare is something we need to get right. Dr. Joe McDonald, who is a Chief Clinical Information Officer in the NHS, the first Chief Clinical Information Officer said to be in the world, a very funny man, a man from Newcastle. He tells this story. His family decided that they were going to build a monitor for the grandmother of the family, his great-grandmother. They put this monitor to detect whether steam was being coming out of the kettle every morning. And they put the monitor over the top of where the kettle was and set it so that if steam wasn't coming out by a certain time, somebody from the family would get a text and they would ring great-grandma. So great-grandma thinks this is great, doesn't really understand it. Culture starts to change. She forgets to get a cup of tea one morning, gets a phone call from Dr. Joe's brother. She thinks this is strange, but nice, somebody's ringing me. Over the next week, she cottons on to the fact that actually if she moves the kettle somewhere else, a member of the family will ring her every morning. Getting the culture right, getting the understanding of what we're implementing with devices, with solutions into healthcare is huge. The grandma in that family beat the culture, changed it, and made it useful to her. And there's a really powerful lesson there, that if we can take the people's view, the patient's view of what we're trying to do, then we can alter the way we deliver. But things are moving so quickly. You know, we go from a device to check whether a kettle's turned on to things like Project Underskin, connecting people by the shake of a hand, being able to see people's blood levels, being able to see whether the person has a heart for you simply by shaking their hand. I wonder how quickly some of this will move to healthcare as we start truly to understand different ways that devices, IoT, the Internet of the patient as we're terming it, can really start to change the way the world works. At the conference over the next day is a section that is devoted entirely to Irish healthcare IoT startups. There are over 40 startups in Ireland related to health and IoT, all pitching their ideas from lunchtime through to the end of the day. It's a big part of Ireland around the digital economy and where we're trying to get to from a healthcare point of view. And we do now start to do that Imagine a World. We've done a lot in the last 12 months in Ireland. We have some pretty big plans for the next 12 months. Starting genomic sequencing, moving to having bipolar solutions that allow patients to be connected to their clinicians, having a supply chain management function for haemophilia patients, and a whole lot more. A digital fabric, as I've said, that will make a big difference. Running in parallel to IoT World are two other events. If you're still around in Dublin on the 22nd and 23rd of November and want to come and look at what innovation means in healthcare, then do pop up to the Science Gallery for have a look. The information about that is on eh2030.com. I hope that's been interesting and a quick whistle-stop tour. Tried to get you a little bit of time back. Thank you very much for your attention and for inviting me.
We've got time for a question or two, if anybody's got one. This gentleman over there. Is that a hand going up or not? No. Okay.
There's one in the
right there. Yeah.
Sure, it's Paweł Stropolski from Intel here in Ireland. I'm just wondering, healthcare, it's a government essentially backed business. How do you envision the funding model for that? Is it, IoT growth is going to be funded by the public funding, or is it a private type of investment needed?
It's a really interesting question. I think it depends very much on the solution being deployed and the type of healthcare arena it's delivering into. So we see some things being prescribed from the health system into patients' homes, into and with patients. So at that point, when it's something that's prescribed as actually delivering care or helping with diagnoses, you'd see that being part of the healthcare system and funded from the HSE, the health system itself. When it's something that a patient is perhaps wanting to be part of and use that information further, then I see it as being a two-tiered arena around funding, so that in some cases people will fund their own IoT-type solutions and use that for adding to their healthcare information. Certainly when we move to an electronic health record, at a point in the future, patients will be able to add their own information to that EHR and that will be a way to actually add a breadth of information to the way the healthcare is delivered.
Thank you.
Cool.
Oh, have we got time for one more?
Yeah, one more.
All right.
Hi, Boris Pratsuk from Ukraine. I have two questions really quick. So medical domain it's really hard to develop. So do you feel lack of developers in this domain? And how is it hard or not to integrate with your electronic records for third-party developers? So is it has APIs or something?
Yeah. Okay,
Thanks.
so first part of the question, you're right. I think it is hard, but more and more people are moving more quickly. A hackathon over 48 hours this weekend went from ideas to an actual solution deployed and able to be given to bipolar patients this morning. A chatbot that keeps them active in conversations and moves forward. So some really cool stuff that's moving quickly. All of our digital solutions across eHealth Ireland and the way we're delivering have to be open APIs, have to enable connectivity and the sharing of information. That's been a standard set across there, and that includes across IoT. Managing the security, as was being said already this morning, is something we need to get right, though, because that opens us up to all sorts of issues. But it's a good question and a good way to drive forward.
Okay.
Thank you very much, everyone.